I'm Rachel, a 31-year-old from Colorado, and back in 2021, I spent 6 months volunteering in Eastern Europe. It was a decision I made after feeling unmoored during the pandemic and wanting to dedicate some time to something bigger than myself. While I initially planned to work with larger organizations, I ended up connecting with a small grassroots group focused on helping vulnerable families in rural areas. That's how I found myself in a small village outside Khmelnytsky, Ukraine, meeting a family whose story has stayed with me ever since. I'd been traveling from town to town, delivering food and medical supplies to families in need. One day, our coordinator told me about a young girl named Alina and her mother, Yulia. Alina was only 8 years old, but she was essentially acting as her mother's caregiver. Yulia had been paralyzed for months, and the family was barely scraping by. When I first heard about their situation, I thought, how is that even possible? How could a child be responsible for so much? But when I met them, I realized the reality was even more heartbreaking than I had imagined. Alina lives in a small, weathered house on the outskirts of her village with her father, Yulia, and occasionally her grandmother, who visits when she can. Their home is simple, with peeling paint on the walls and a few chickens roaming the yard. When I arrived, Alina greeted me with a shy but polite smile, her small frame carrying an air of quiet responsibility far beyond her years. She was carrying a tray with soup and tea for her mother, who was lying on a hospital-style bed set up in their living room. Yulia greeted me warmly, though her voice was faint. She tried to sit up to shake my hand, but Alina quickly intervened, gently laying her back down and fussing over her comfort. It was clear that Yulia's condition was dire, her legs were motionless, and her right arm hung limp. But what struck me most was the resignation in her eyes. She seemed exhausted, not just physically but emotionally, from the weight of her illness and the toll it had taken on her family. I spent hours that day listening to their story, piecing together the fragments of their life. Yulia had been healthy until 4 years earlier when she started experiencing unexplained symptoms, blurred vision in one eye, weakness in her limbs, and eventually, severe pain. The local clinic diagnosed her with multiple sclerosis, but when she traveled to Kiev for a second opinion, specialists dismissed the diagnosis, saying they couldn't confirm it without more tests. Tests the family couldn't afford. Over the years, Yulia's condition worsened. By 2021, she was bedridden, unable to care for herself. Her husband, Oleg, worked construction jobs in nearby towns, but his income barely covered food and utilities, leaving no room for medical expenses. The local healthcare system, underfunded and overwhelmed, had little to offer. Social services, if they existed at all in this remote village, never showed up. It was Alina who became her mother's caregiver. Alina's day starts before dawn. She wakes up to change Yulia's diapers, prepare her breakfast, and massage her arms and legs as instructed by the doctors. When Yulia cries in frustration or pain, Alina comforts her, often reading poems or telling stories to lift her spirits. Once her mother is settled, Alina tidies the house, feeds the chickens, and, if there's time, does her schoolwork. She sometimes sneaks outside to play with her friends, but only if she's confident everything at home is in order. Talking to Alina felt like talking to an adult trapped in a child's body. She spoke with a maturity born of necessity, explaining her routine without complaint. "Mama needs me," she said simply. But I could see the exhaustion in her eyes and hear the longing in her voice when she talked about her favorite games or the books she wished she had more time to read. Yulia's situation is a direct result of systemic failures. Rural Ukraine struggles with a lack of accessible healthcare and social support, especially for families like theirs. The nearest hospital is hours away, and even when Yulia was admitted, the care she received was rudimentary, basic painkillers and a vague recommendation to seek further treatment, which they couldn't afford. The family couldn't hire home health aides or afford regular transportation to bigger cities for care. They were stuck in an impossible situation. Back in the US, I knew Alina's life would look very different. Programs like Medicaid could provide in-home aids or physical therapy, and organizations might step in to support a struggling family. Alina would be in school full-time, with access to counseling and extracurricular activities, instead of shouldering the responsibilities of an adult. It made me painfully aware of how geography determines so much of a person's fate. When I returned to visit Alina and Yulia a few days later, I arrived earlier than expected and caught a glimpse of their daily routine. The sun was barely up, but Alina was already awake, bustling around the small kitchen. She was wearing an oversized apron that almost swallowed her tiny frame, her hands carefully chopping vegetables for her mother's soup. Occasionally, she would glance toward the living room, where Yulia lay on her hospital-style bed. Alina's morning routine was meticulous. She started by washing her mother's face and brushing her hair, a task she took great care with, almost as if she were styling a doll. She then massaged Yulia's legs and arms, softly counting out each movement like she'd been instructed by a doctor long ago. Despite her age, Alina's hands moved with practiced precision, though I noticed her small shoulders tremble slightly under the strain of lifting her mother to adjust her position. By the time I stepped into the house, Alina had already prepared breakfast and was feeding her mother with a spoon, her movements careful but efficient. She greeted me with her usual shy smile, but I could tell she was nervous about someone seeing her routine. "I have to do everything right," she told me later, "or Mama will be in pain." Yulia's condition is both physically and emotionally taxing for the family. She experiences chronic pain and frequent muscle spasms, which require constant care and occasional medication that the family can barely afford. The nearest pharmacy is 2 hours away by bus, and Yulia's prescriptions are expensive, even by local standards. Oleg, her husband, works long hours in construction, leaving early in the morning and returning late at night. Though he does his best to provide for the family, the strain of being the sole breadwinner weighs heavily on him. "He works hard for us," Alina said one afternoon, "but sometimes I think he feels guilty that he can't help Mama more." Her voice was matter-of-fact, but her words carried an unspoken truth. The family's financial struggles have made her father distant. His absences, though necessary, mean that much of the emotional burden also falls on Alina. The few relatives they have live in neighboring villages but visit only occasionally. Alina's grandmother comes when she can, offering support and a break for the little girl, but her own health issues limit how much she can do. Social services, which might have been a lifeline, are practically non-existent in this rural part of Ukraine. Even the village doctor only visits once a month, and her advice is limited to basic remedies and vague reassurances. What struck me most about Alina was her resilience. Despite the overwhelming responsibilities, she had a quiet determination that belied her age. She spoke about her mother with such love and care, as though she were describing her most precious treasure. Yet, there were moments when the cracks showed. One afternoon, I found her sitting outside on a wooden bench, staring into the distance. When I asked if she was okay, she hesitated before saying, "Sometimes, I wish Mama wasn't sick, so she could take care of me again." Her words were a gut punch, a reminder of how much Alina had lost. She wasn't just caring for her mother, she was also grieving the life she should have had. She rarely had time to play with her friends, and even when she did, she admitted she couldn't relax completely. "I worry about Mama," she said. "What if she needs me while I'm outside?" The more time I spent with Alina, the more I saw how her situation was shaping her into someone far older than her years. She spoke about her future with a mix of hope and practicality. "I want to be a doctor," she said one day, "so I can help people like Mama." When I asked her what else she wanted, she paused and said softly, "To go to school every day." One evening, I asked Yulia how she felt about Alina taking on so much responsibility. Tears welled up in her eyes as she said, "It breaks my heart. She should be playing, not taking care of me. But what choice do we have?" Yulia's voice trembled as she admitted that she had considered asking her husband to send Alina to live with relatives so she could have a more normal childhood, but the thought of being separated from her daughter was unbearable. "She's my light," Yulia whispered. "She keeps me going." Yulia's health has deteriorated so much because of delays in treatment and misdiagnosis. In the early stages of her illness, doctors attributed her symptoms to stress and minor infections, prescribing painkillers instead of investigating further. By the time she sought a second opinion in Kiev, her condition had progressed significantly. Specialists suspected a rare neurological disorder but lacked the resources to confirm it. Without a clear diagnosis, Yulia was sent home with little more than instructions to rest and take vitamins. Every time I visited, I couldn't help but compare Alina's life to that of children in the United States. Back home, a child in her situation would likely have access to counseling, school support programs, and respite care services. Yulia could have qualified for Medicaid or similar programs, which might have provided in-home health aides or even covered the cost of rehabilitation. Instead, this family was left to fend for themselves in a system that seemed to have forgotten them. As much as I wanted to change their circumstances, I felt powerless against the systemic issues that had led to their situation. All I could do was offer small comforts, bringing groceries, arranging for donations of medical supplies, and spending time with Alina to give her a chance to be a kid again, even if only for an hour or two. When I started volunteering in Ukraine, I'd hoped that the small, close-knit communities I visited would rally around families like Alina's. In my mind, rural villages were places where neighbors knew each other, where people came together in times of hardship. And while that was true to an extent, the reality I saw was far more complicated. Alina's village, like many in the region, is home to people who are also struggling to survive. Most families here are elderly, living off small pensions that barely cover essentials. Younger people have left for cities or other countries to find work, leaving the community with limited resources to help those in need. Even when neighbors wanted to assist, their ability to do so was constrained by their own financial and physical limitations. During one of my visits, I spoke with a neighbor, an older woman named Oksana who sometimes stopped by to check on Alina and her mother. Oksana was kind but pragmatic, explaining how difficult it was for anyone in the village to give more than moral support. "We're all just trying to get by," she said. "We help when we can, but we don't have much ourselves." This was evident when I visited the local school to talk to Alina's teacher. The school was a small, aging building with a handful of classrooms and a playground that had seen better days. Alina's teacher told me how the school had tried to accommodate her by allowing her to attend only a few hours a day so she could manage her caregiving responsibilities. But with limited staff and resources, there wasn't much else they could do. Alina's teacher was worried about her. "She's bright, but she's always tired," the teacher said. "And she doesn't get to socialize with the other children much. She's missing out on so many important things." One day, I sat with Alina in their small yard while she fed the chickens. It was a rare moment of calm, and I asked her if she ever felt angry or frustrated about her situation. She paused, her hands scattering feed as she thought. "Sometimes," she admitted. "But Mama needs me, so I can't think like that." Her words stayed with me. Here was a child who had every right to feel upset, yet she had chosen to focus on her role as her mother's helper. But I couldn't help wondering how long she could keep it up before the emotional toll became too much. Despite the systemic failures and the lack of community support, there were moments of hope. Our organization managed to bring in some supplies for the family, including a proper wheelchair for Yulia. When the wheelchair arrived, Alina's face lit up with excitement. For the first time in months, Yulia could sit upright and move around the house with assistance. It was a small change, but it meant the world to them. I also worked with a local doctor to arrange a more thorough medical evaluation for Yulia. It wasn't easy, there were forms to fill out, fees to pay, and a long wait for an appointment, but we eventually managed to get her seen by a specialist in Khmelnytsky. While the visit didn't provide a definitive diagnosis, it did lead to a new treatment plan aimed at managing her pain and improving her mobility. Alina was thrilled to see her mother's spirits lift, even if only slightly. "Mama smiled today," she told me excitedly one evening. She hasn't smiled like that in a long time. Perhaps the most meaningful victory was giving Alina the chance to just be a child, even if only for a short time. I started bringing small gifts on my visits, a set of colored pencils, a jump rope, or a book in Ukrainian. I'd sit with her as she drew pictures or read aloud, her face lighting up with joy. It wasn't much, but it was enough to remind her that she deserved happiness, too. One afternoon, I brought a soccer ball and invited Alina and some of the village kids to play in a nearby field. She was hesitant at first, worried about leaving her mother alone, but Yulia reassured her it was okay. Watching Alina laugh and run around with the other children was like seeing a different person, a carefree, giggling little girl, if only for an hour. As I continued my visits, I began to notice small shifts in the community. Inspired by our organization's efforts, a few neighbors started dropping by more often, bringing food or helping with small chores. Alina's teacher began advocating for her to attend school more regularly, arranging for a classmate to walk her home each day. These weren't monumental changes, but they were steps in the right direction. Still, the underlying issues remained. The family's situation was a stark reminder of how vulnerable people in rural areas are to being forgotten. They needed more than occasional donations or kind gestures. They needed systemic change, better healthcare, accessible social services, and a safety net that didn't rely on luck or charity. As I spent more time with Alina and her family, I couldn't help but think about how their lives might be different if they lived in another country, somewhere with stronger social support systems and more accessible healthcare. Growing up in the United States, I often took things like medical insurance, social services, and public education for granted. Seeing Alina's struggles made me realize just how critical these systems are, even if they're not perfect. If Alina lived in the US, she likely wouldn't bear the overwhelming burden of being her mother's primary caregiver. Programs like Medicaid could provide home health aides to assist Yulia with daily tasks such as bathing, eating, and managing her medical needs. This would allow Alina to focus on being a child, going to school, playing with friends, and exploring her interests without the constant worry of whether her mother was okay. For families like Alina's, community organizations and government programs often step in. Churches, local charities, and nonprofit organizations might provide everything from meals to transportation for medical appointments. Social workers could ensure that Alina had access to counseling to process the stress and emotional toll of her situation. In short, there would be a network of support, helping to share the weight of responsibility that currently falls entirely on her young shoulders. Yulia's medical care would also look drastically different. While healthcare costs in the US are notoriously high, a condition like Yulia's would likely qualify her for disability benefits. These benefits could help cover some of the costs of treatment and ensure she had access to the specialists and therapies she desperately needs. Physical therapy and rehabilitation services would be more readily available, potentially improving her mobility and quality of life. Moreover, Yulia wouldn't have to travel hours just to see a doctor or pick up medications. In rural Ukraine, the lack of infrastructure means that even basic healthcare is difficult to access. By contrast, many American communities, even smaller ones, have clinics or pharmacies within a reasonable distance. Telemedicine services might also provide an additional layer of care, allowing Yulia to consult with specialists without leaving her home. For Alina, education would be another area of difference. In the US, schools often provide additional support for children in difficult home situations. Counselors and teachers would be aware of her challenges and could help her stay on track academically. She might even qualify for after-school programs or summer camps, giving her opportunities to build friendships and experience the joys of childhood that she's currently missing. The stark contrast between what Alina's life could be and what it actually is weighed heavily on me. It wasn't fair that a little girl's future was so profoundly shaped by where she happened to be born. While I tried to remind myself that systemic issues exist everywhere, the disparity was undeniable. Alina was facing challenges that no child should ever have to endure, simply because her family didn't have access to the resources they needed. One day, I sat down with Alina and asked her what she imagined her life could look like if things were different. At first, she seemed puzzled by the question, but then she started to dream out loud. If Mama could walk again, she said, I'd go to school every day and play soccer after. I'd show her my drawings, and she'd clap for me. And maybe we could go to the park together. Her words broke my heart. The things she dreamed of were so simple, yet so far out of reach in her current circumstances. For a moment, I thought about telling her that in some parts of the world, families like hers get the help they need. But I held back. I didn't want to fill her with false hope or make her feel like her life was somehow lesser. Instead, I promised her that I would do everything I could to make her dream even a little closer to reality. In reflecting on the differences between Alina's situation and what might be possible elsewhere, I realized how much privilege I'd taken for granted. I'd grown up in a system where help, while not perfect, was available. Alina and her family had no such safety net, and they weren't alone. There were countless other families in villages like hers, quietly struggling, with no one to advocate for them. The experience made me more determined than ever to raise awareness about the gaps in Ukraine's healthcare and social services. If we could bring even a fraction of the resources available in wealthier nations to families like Alina's, it could transform their lives. But for now, all I could do was be there, to listen, to help where I could, and to remind Alina that she was never truly alone. As I spent more time in Ukraine, it became clear that the challenges faced by Alina and her family were not unique. Across rural areas, I saw similar stories of people falling through the cracks of an underfunded and overburdened system. Alina's situation was heartbreaking, but it was also emblematic of deeper systemic failures that left vulnerable families to fend for themselves. One of the biggest issues is the lack of accessible healthcare. In Alina's village, the nearest clinic was 2 hours away, and even there, the services were minimal. When Yulia first started experiencing symptoms, local doctors could only provide basic painkillers and vague advice. The family eventually traveled to Lviv for a more comprehensive evaluation, but the journey was expensive and exhausting. Despite seeing specialists, they still didn't receive a clear diagnosis, leaving Yulia without a treatment plan. This pattern is common in Ukraine's rural healthcare system. Hospitals are often poorly equipped, and the cost of advanced diagnostics or treatments is out of reach for many families. For conditions like Yulia's, which may require ongoing care and specialized equipment, the resources simply don't exist in small villages. Patients are left to rely on their families, who often lack the knowledge, time, or money to provide adequate care. Another major problem is the absence of robust social services. In the U.S., a family like Alina's might receive visits from social workers, assistance with caregiving, and financial support for medical expenses. But in Ukraine, especially in rural areas, these services are either unavailable or severely limited. Social workers rarely visit villages, and even when they do, their ability to provide meaningful help is constrained by a lack of funding and staff. For Alina, this meant that no one stepped in to lighten her burden. There were no programs to provide Yulia with a home health aide or to offer counseling for Alina as she struggled to balance her responsibilities with her own emotional well-being. Without external support, the family was left isolated, with the weight of Yulia's illness resting squarely on Alina's small shoulders. Economic hardship compounds these issues. Ukraine's rural areas have been hit hard by economic stagnation, leaving many families living paycheck to paycheck. Alina's father, Oleg, works long hours in construction, but his income barely covers basic necessities like food and utilities. The family can't afford private healthcare or additional caregiving support, and they're not alone. Many families in similar situations face impossible choices between paying for medical treatments or keeping the lights on. When I talked to Oleg about the family's finances, his frustration was palpable. "I want to do more for them," he said, "but what can I do? There's no money, and there's no help." His words echoed the sentiments of so many parents I met, people who were doing everything they could, yet still felt powerless to change their circumstances. The lack of a safety net also reflects broader cultural attitudes. In Ukraine, there's a strong expectation that families will take care of their own, even in the most difficult situations. While this sense of duty is admirable, it can also place an unbearable strain on families like Alina's, who simply don't have the resources to cope. There's little public awareness or advocacy for systemic reform, and many people accept the status quo as unchangeable. This is where international aid can play a crucial role. Organizations like the one I worked with help fill some of the gaps, providing medical supplies, food, and other essentials to families in need. But these efforts are only a temporary fix. What's really needed is long-term investment in Ukraine's healthcare and social service infrastructure. During my time in Ukraine, I worked with my organization to connect Alina's family with as many resources as possible. We arranged for regular food deliveries, secured funding for a wheelchair, and even covered the cost of transportation to a better-equipped hospital in Kyiv. These interventions made a tangible difference, but they also highlighted how much more was needed. International aid could help address these gaps on a larger scale. By funding rural healthcare programs, supporting training for social workers, and advocating for policy changes, aid organizations can help build a safety net for families like Alina's. Partnerships between local and international groups can also amplify these efforts, ensuring that resources are directed where they're needed most. Reflecting on Alina's story, I was struck by how much potential there was for change. The challenges she and her family faced weren't insurmountable, they were the result of systemic neglect, not an inherent lack of resources or compassion. With the right support, Yulia could receive the care she needed, and Alina could reclaim her childhood. But without systemic reform, families like theirs would continue to suffer in silence. Working with Alina's family wasn't just a challenge, it was an emotional roller coaster that forced me to confront my own limits and assumptions. Every time I visited their small home, I was struck by the overwhelming weight of their circumstances, yet also by the incredible strength and love that kept them going. While I tried to bring practical help, the emotional toll on Alina and her mother was always present, a quiet undercurrent that shaped every interaction. Alina's resilience was nothing short of remarkable, but it was clear that her role as a caregiver came at a steep emotional cost. At only 8 years old, she had taken on responsibilities that would be daunting for most adults. She rarely expressed frustration or sadness, but her quiet moments often spoke volumes. I'd catch her staring out the window while washing dishes or hugging her knees in the corner after a particularly tough day. When I asked her how she was feeling, she'd usually shrug and say, "I'm fine." But her tired eyes told a different story. One afternoon, while we were drawing in the yard, I asked her what she missed most about her life before her mom got sick. At first, she hesitated, then said, "I miss when Mama would braid my hair before school. She used to tell me stories while she did it." Her voice wavered, and for the first time, I saw tears well up in her eyes. It was a small, intimate moment that revealed just how much she had lost, not just her childhood, but the sense of being cared for by the one person she depended on most. Yulia's emotional burden was equally profound. As her condition worsened, she became increasingly dependent on Alina, a fact that filled her with guilt. "She should be playing with her friends, not looking after me," she said during one of my visits. Her voice was thick with emotion, and she turned her face away to hide her tears. "I'm her mother. I'm supposed to take care of her, not the other way around." The strain of her illness was evident in every word she spoke. She constantly worried about what would happen to Alina if her condition didn't improve. "What kind of life can she have if this is all she knows?" she asked me one evening. Despite her love for her daughter, she feared that her presence was holding Alina back from experiencing a normal childhood. Yulia also struggled with the isolation that her illness brought. Friends and neighbors visited occasionally, but their offers of help were limited, and she felt like a burden. "People don't know what to say or do," she explained. "It's easier for them to stay away." This sense of loneliness only deepened her despair, making it harder for her to hold on to hope. As a volunteer, I wasn't prepared for how deeply Alina's story would affect me. At first, I approached the situation with a sense of purpose, determined to provide practical solutions and advocate for the family. But the more time I spent with them, the more I realized how emotionally draining it was to witness their struggles firsthand. I often felt helpless, frustrated by the limits of what I could do. There were days when I left their home feeling like I'd failed them. No matter how many groceries I delivered or how many calls I made to arrange medical appointments, it never felt like enough. The systemic issues were so large, and the family's needs so great, that my efforts often felt like drops in an ocean. I started to question whether I was making any real difference, and the weight of that doubt was hard to shake. At the same time, I found myself inspired by Alina's courage and Yulia's determination. Their ability to find moments of love and laughter, even in the face of overwhelming adversity, was a constant reminder of the strength of the human spirit. It gave me the motivation to keep going, even when the challenges felt insurmountable. One of the most rewarding aspects of my time with Alina's family was the connection we built. Alina began to trust me in a way she didn't with many adults, opening up about her fears and dreams. Yulia, too, started to see me not just as a volunteer but as a friend. These relationships reminded me that sometimes, the most important thing you can offer isn't a solution, it's simply being present and showing that someone cares. There was one moment that particularly stuck with me. During a difficult visit, when Yulia was in severe pain and Alina was visibly overwhelmed, I suggested we all sit together and take a few deep breaths. Alina climbed into her mother's lap, and Yulia rested her good hand on her daughter's shoulder. For a few minutes, we just sat in silence, letting the weight of the moment settle without trying to fix it. When I left that day, Alina hugged me tightly and whispered, "Thank you for being here." While I often felt powerless to change the family's circumstances, I learned that even small gestures could have a meaningful impact. Whether it was bringing Alina a new set of colored pencils or arranging for a doctor to visit Yulia, these moments reminded them that they weren't alone. And in a situation where so much felt out of their control, that sense of connection made a difference. Alina's story also changed me. It gave me a deeper understanding of the importance of empathy and resilience, and it strengthened my commitment to advocating for systemic change. I left Ukraine with a renewed sense of purpose, determined to share their story and work toward a world where no family has to face such hardships alone. In the months I spent with Alina's family, there were moments of light amid the darkness, small victories that reminded me why I'd come to Ukraine in the first place. Though the systemic issues were daunting and the family's challenges far from resolved, these wins felt monumental in a situation where even a tiny change could make a big difference. One of the biggest victories came when we managed to arrange for Yulia to visit a specialist in Kiev. It wasn't easy. The trip required careful coordination, funding for transportation, finding a clinic willing to prioritize her case, and securing an appointment on a tight schedule. On the day of the visit, I accompanied the family to the city, helping them navigate the unfamiliar hospital system. The specialist didn't provide a miracle cure, but he did confirm a diagnosis, an advanced form of a neurological disorder similar to multiple sclerosis. He prescribed a new course of treatment and suggested physical therapy that could help Yulia regain some mobility in her arms. While the prognosis was guarded, the clarity and direction were a huge step forward. For the first time in months, Yulia felt like she had a plan, and that hope alone was transformative. Another victory came in the form of a day of play for Alina. One weekend, I organized a small gathering with other volunteers and local children in the village. We brought soccer balls, chalk for drawing, and snacks to create a makeshift field day. I managed to convince Alina to join, assuring her that her grandmother would stay with her mother while she played. Seeing Alina laugh and run with the other kids was one of the most heartwarming moments of my time in Ukraine. She played soccer with a fierce determination, her face lighting up with each goal she scored. For a few hours, she wasn't a caregiver or a problem solver, she was just an 8-year-old girl, carefree and full of energy. At the end of the day, she hugged me and said, "That was the best day ever." While the village lacked formal support systems, the attention our organization brought to the family's situation began to spark small changes. Neighbors started visiting more often, bringing meals or offering to help with chores. Alina's teacher began advocating for her to attend school more regularly, working with the family to ensure she could balance her responsibilities at home with her education. One neighbor, an older man who owned a small farm, even volunteered to take care of the family's chickens and garden so Alina could have more free time. These gestures, though modest, showed that the community cared and was willing to rally around the family when given the opportunity. During one of my visits, I brought Alina a notebook and some colored pencils. I'd noticed her love for drawing, often sketching pictures of her mother and the flowers in their yard on scraps of paper. When I gave her the supplies, her eyes lit up, and she immediately sat down to start drawing. Over the weeks that followed, I watched her fill the notebook with colorful, imaginative scenes, fields of sunflowers, animals, and portraits of her family. Drawing became a way for her to express herself, to channel her emotions into something creative. She proudly showed me her sketches during each visit, and I encouraged her to dream big. "Maybe you'll be an artist one day," I told her, and her shy smile hinted at the possibility. These small victories taught me a profound lesson about resilience and perspective. Back home in Colorado, I'd often taken things like healthcare, education, and social services for granted. Seeing Alina and Yulia's struggles, and their ability to find joy despite them, forced me to reevaluate what truly matters. I began to see privilege in a new light. Privilege wasn't just about having more resources, it was about having access to systems that provide security and support when life becomes difficult. Alina didn't lack strength or determination, she lacked the safety net that every family deserves. Before coming to Ukraine, I'd been searching for a sense of purpose. I wanted to make a difference, but I also wanted to understand the world beyond my own experiences. Alina's story gave me both. It showed me the power of human connection, the importance of advocacy, and the need for systemic change. When I eventually left the village, I knew my work wasn't finished. I stayed in touch with the family through the local volunteers, who continued to provide support. I also began sharing their story with friends and colleagues back home, raising funds for their ongoing medical expenses and spreading awareness about the challenges faced by families in rural Ukraine. The victories we achieved were small but meaningful. They didn't erase the family's hardships, but they gave them a glimmer of hope, a reminder that they weren't alone. And for me, they reinforced the idea that even small acts of kindness can have a ripple effect, creating change in ways you might not expect. As my time in Ukraine came to an end, I found myself reflecting not just on Alina's story, but on the broader implications of her family's struggles. Their situation wasn't unique, it was one of countless similar stories playing out in villages across Ukraine and around the world. What set them apart, for me, was the courage, love, and resilience they showed in the face of overwhelming adversity. One of the most striking lessons I learned was how much a person's fate is shaped by where they happen to be born. Alina and her family weren't facing insurmountable challenges because of personal failings, they were caught in a system that lacked the resources to support them. In another country, their story might have been different. Yulia could have received early intervention for her illness, Alina could have focused on school and friends, and the family could have leaned on social services to help them navigate tough times. This inequity isn't just a problem for Ukraine, it's a global issue. Families in under-resourced areas, whether in rural Ukraine, sub-Saharan Africa, or parts of Appalachia in the United States, face similar challenges. They are often left to navigate complex and broken systems on their own, with little hope of meaningful change. My experience with Alina's family reinforced the importance of international aid in addressing these inequities. While systemic change must ultimately come from within, external support can provide the resources and momentum needed to kickstart reforms. Organizations that focus on healthcare, education, and social services play a vital role in bridging gaps and creating opportunities for families like Alina's. However, aid alone isn't enough. It needs to be coupled with advocacy and capacity building to ensure that local governments and communities can sustain progress over the long term. This includes training healthcare workers, improving infrastructure, and fostering a culture of accountability and transparency. While the scale of systemic problems can feel overwhelming, my time with Alina taught me the power of small actions. A single wheelchair, a day of play, or even a notebook of colored pencils can make a profound difference in someone's life. These gestures don't solve the root problems, but they remind people that they're not alone, and that reminder can be transformative. In Alina's case, the small victories we achieved gave her a chance to be a child again, even if only for a moment. They also showed her that there are people who care, both nearby and far away. That knowledge can be a powerful source of hope, giving her the strength to keep moving forward. Alina's story isn't just a tale of hardship, it's a call to action. It's a reminder that we all have a role to play in building a more equitable world. Whether through volunteering, donating, or advocating for policy changes, there are countless ways to make a difference. Even sharing stories like Alina's can help raise awareness and inspire others to get involved. For me, the experience solidified my commitment to social justice and global equity. Since returning home, I've worked to raise funds for families like Alina's and to advocate for systemic reforms in Ukraine and beyond. It's a small contribution, but it's one I hope will have a ripple effect. As I said my goodbyes to Alina and her family, I couldn't help but feel a mix of emotions. I was proud of what we had accomplished together, but I was also acutely aware of how much more work needed to be done. Still, I left with a sense of hope, not just for their future, but for the potential of collective action to create change. Alina's story stays with me to this day. It reminds me of the resilience of the human spirit, the importance of empathy, and the power of community. And it's a story I'll continue to share, in the hopes that it will inspire others to take action and to see the world through a lens of compassion and possibility.